Ever wondered why your period is unusually heavy or irregular? Let's talk about a common health concern for women, abnormal uterine bleeding or AUB. If you are new here, welcome to my YouTube channel. Kindly like, subscribe and share the informative videos on this channel. To my returning viewers, thank you for your patronage. Simply put, AUB means experiencing unusual bleeding from your uterus. This could be bleeding that's heavier or lighter than usual, happens more often, or occurs between your periods. While some variation in your menstrual cycle is normal, significant changes can be a sign of an underlying issue. Don't worry, we're here to break it down for you. We'll discuss the causes, symptoms, and what you can do about it. It's important to remember that you're not alone, and many women experience AUB at some point in their lives. The good news is that with the right information and support, you can manage AUB and prioritize your health. So, let's dive in and learn more about this common condition. AUB can impact a woman's life in various ways. Heavy bleeding can lead to fatigue and anemia, while irregular cycles can cause anxiety and disrupt daily routines. In some cases, AUB can be a sign of a more serious condition that requires medical attention. That's why it's crucial to pay attention to your body and recognize any changes in your menstrual cycle. If you have not watched the previous video on the menstrual cycle, the link is on the description box. Early detection and treatment are key to managing AUB and preventing potential complications. If you notice anything unusual or concerning about your bleeding patterns, don't hesitate to reach out to your healthcare provider. Now, let's talk about what causes AUB. One of the most common culprits is a hormonal imbalance. Our hormones play a big role in regulating our menstrual cycles. Think of it like a delicate dance between estrogen and progesterone. When these hormones are out of sync, it can throw off your period, leading to irregular bleeding patterns. This can happen for various reasons such as stress, significant weight loss or gain, or even certain medications. Imagine a seesaw. When one side is higher, the other is lower. Similarly, if your estrogen levels are too high or too low, it can disrupt the normal buildup and shedding of your uterine lining, causing unusual bleeding. Don't worry, we'll talk about how to identify these hormonal imbalances and what you can do to restore harmony to your cycle. Remember, knowledge is power when it comes to understanding your body. Another common cause of AUB is the presence of growths in the uterus, such as fibroids or polyps. Fibroids are non-cancerous tumors that grow in the muscle wall of the uterus. They can range in size from tiny seeds to large grapefruits. Polyps, on the other hand, are soft, fleshy growths that develop on the lining of the uterus. While both fibroids and polyps are usually benign, they can cause heavier bleeding or bleeding between periods. Think of your uterus like a cozy room, and fibroids and polyps are like extra pieces of furniture taking up space. This can put pressure on the uterine lining, leading to abnormal bleeding. The good news is that many women with fibroids or polyps experience minimal or no symptoms. However, if these growths become large or numerous, they can cause discomfort and disrupt your menstrual cycle. While hormonal imbalances and uterine growths are common culprits behind abnormal uterine bleeding, several other factors can contribute to this condition. Certain medical conditions such as thyroid disorders, polycystic ovary syndrome, and endometriosis can also disrupt your menstrual cycle and lead to abnormal bleeding. Medications like blood thinners and some hormonal therapies, including birth control pills, can also cause changes in your bleeding patterns. In some cases, abnormal uterine bleeding might be a side effect of certain medications or a sign of an underlying medical condition that requires attention. It's important to remember that every woman's body is unique, and what's considered normal for one person may not be for another. That's why it's crucial to pay attention to your body and seek medical advice if you notice any significant or persistent changes in your menstrual cycle. Just like our bodies change throughout life, so do our menstrual cycles. Age plays a significant role in the likelihood of experiencing abnormal uterine bleeding. During puberty, as our bodies adjust to the influx of hormones, it's common to have irregular periods. This is a time of great change, and our reproductive systems are still maturing. It's like learning to ride a bike. It takes time to find our balance and for everything to run smoothly. As we transition into our reproductive years, our cycles tend to become more regular. However, in the years leading up to menopause, we may experience fluctuations in hormone levels, leading to irregular or heavy bleeding. This phase, known as perimenopause, is a natural part of aging, but it can bring about some unexpected changes in our menstrual patterns. It's important to remember that every woman's experience is unique, and there's no set timeline for these transitions. Our weight and overall health also play a role in the health of our reproductive systems. Being overweight or obese can increase the production of estrogen, which can disrupt the balance of hormones in our bodies. Excess weight can tip the hormonal scales, leading to irregular periods or heavy bleeding. On the other hand, being significantly underweight or having very low body fat can also interfere with hormone production. This is often seen in athletes or individuals with eating disorders. Just like a plant needs the right amount of sunlight and water to thrive, our bodies need a healthy balance of nutrients and energy to function optimally. Maintaining a healthy weight through a balanced diet and regular exercise is essential for overall well-being, including reproductive health. Sometimes, abnormal uterine bleeding can be a sign of an underlying medical condition that requires attention. Certain conditions, such as polycystic ovary syndrome, thyroid disorders, and endometriosis, can disrupt our hormonal balance and lead to irregular bleeding. Polycystic ovary syndrome, a hormonal disorder common among women of reproductive age, can cause cysts to form on the ovaries, affecting ovulation and hormone production. Thyroid disorders, which affect the thyroid gland, responsible for regulating metabolism, can also impact hormone levels and menstrual cycles. Endometriosis, a condition where tissue similar to the uterine lining grows outside the uterus, can cause pain, inflammation, and irregular bleeding. These conditions often require medical management to alleviate symptoms and prevent complications. It's essential to pay attention to your body's signals and seek medical advice if you experience persistent or concerning changes in your menstrual cycle. Remember, early detection and treatment are key to managing these conditions and maintaining your overall health. Now that we've explored the potential causes and risk factors of abnormal uterine bleeding, let's talk about how to recognize it. Every woman's menstrual cycle is unique, and what's considered normal can vary from person to person. However, there are some general guidelines to help you determine if your bleeding patterns fall within a healthy range. A typical menstrual cycle lasts between 21 and 35 days, with bleeding lasting for 2 to 7 days. Pay attention to the heaviness of your flow. Soaking through a pad or tampon every hour or two is considered heavy bleeding and could be a sign of abnormal uterine bleeding. Similarly, passing large clots, especially those bigger than a quarter, is also cause for concern. Keep track of the frequency of your periods. If you're experiencing cycles that are consistently shorter than 21 days or longer than 35 days, or if you're skipping periods altogether, it's essential to consult your doctor. While some menstrual irregularities are common, certain symptoms warrant immediate medical attention. If you experience any of the following, don't hesitate to reach out to your healthcare provider or seek emergency care. Unusually heavy bleeding, severe pelvic pain, bleeding longer than 7 days, or bleeding after menopause or intercourse. Always err on the side of caution and seek medical advice if you are experiencing any unusual symptoms. Talking about our menstrual cycles can feel uncomfortable or even taboo for some women. However, it's crucial to remember that your cycle is a vital sign of your overall health. Just like you would discuss any other health concern with your doctor, don't be afraid to speak openly and honestly about your menstrual experiences. Keep track of your cycle using a calendar or period tracking app. Note the start and end dates of your periods, the heaviness of your flow, and any unusual symptoms you experience. This information will be valuable for your doctor in assessing your situation and recommending appropriate treatment options. Remember, you are your own best advocate. Don't be afraid to ask questions, express your concerns, and seek support from your healthcare provider. With the right information and support, you can manage AUB and prioritize your reproductive health. Diagnosing AUB. When you visit your doctor with concerns about AUB, they'll want to understand your individual experience. This begins with a conversation about your medical history. Be prepared to discuss your menstrual cycle in detail. Your doctor will likely perform a physical exam, including a pelvic exam. To get a clearer picture, your doctor might recommend some tests. Finding the right path. Treatment options for AUB. Once your doctor identifies the cause of your AUB, they can recommend a personalized treatment plan. Options range from lifestyle changes and medications to procedures and surgery. Hormonal imbalances may be treated with birth control pills or IUDs. These can regulate cycles and reduce symptoms. Fibroids or polyps might require non-invasive procedures. These can shrink fibroids or remove the uterine lining. Discuss benefits and risk with your doctor to find the best option. Your journey to wellness. Navigating AUB can feel overwhelming at times, but remember that you're not alone. Don't underestimate the power of self-care in managing AUB and its impact on your daily life. Simple lifestyle changes, such as getting regular exercise, eating a balanced diet rich in iron, and managing stress through techniques like yoga or meditation, can make a significant difference. Sharing your experience with trusted friends or family members can provide emotional support and help alleviate feelings of isolation. Remember that seeking professional help is a sign of strength, not weakness. We've covered a lot of ground today, from understanding what abnormal uterine bleeding is to exploring its causes, risk factors, symptoms, and treatment options. While it can feel daunting at times, remember that knowledge is power. Remember those key takeaways. Pay attention to your cycle, noting any significant changes in flow, duration, or frequency. Don't hesitate to reach out to your healthcare provider if you have any concerns. Early detection and treatment are crucial for managing AUB and preventing potential complications. Remember, you are not alone on this journey. Reach out to your loved ones, connect with support groups, and prioritize self-care practices that nourish your mind, body, and spirit. Whether it's practicing mindfulness, engaging in gentle exercise, or simply taking some time for yourself, these small acts of self-love can make a world of difference in managing the emotional and physical challenges of AUB. Above all, be kind to yourself. Healing takes time, and it's okay to have good days and bad days. Celebrate your strength and resilience, and remember that you deserve to live a healthy, fulfilling life, free from the constraints of AUB. With the right information, support, and self-care, you can navigate this condition and embrace a brighter, healthier future. Kindly like, share, and subscribe for more of health informative videos.